The broadcast is now starting. All attendees are in listen-only mode.
Right. Hello, everyone, and good morning, and welcome to episode 4 of NTUH-RSCM joint webinar series on sharing expertise to fight COVID-19. Our topic for today is mental health support in COVID-19 pandemic. First of all, I would like to thank the esteemed faculty members for taking the time today to share their expertise and experience in fighting against COVID-19, as well as to our viewers for tuning in today. Now, I would like to invite the Director of Human Resources, Education, and Research of Cipto Mangunkusumo Hospital, Dr. Trimartani, to open today's webinar with some opening remarks. Thank you for being here with us today. Dr. Trimartani, the time is yours.
Thank you very much, Karin. Assalamualaikum warahmatullahi wabarakatuh. Good morning to all. I'm Trimartani, Director of Human Resource and Education and Research from Dr. Cipto Mangunkusumo. And on behalf of our CEO, Dr. Kristiana, I would like to extend warm welcome to all speakers and moderators. To Professor Yi-Ting as the attending physician, Department of Psychiatry, National Taiwan University, Dr. Kristiana Siste as the head of Department of Psychiatry, RSCM, Faculty of Medicine, University of Indonesia, Dr. Petrin, Redayani Lukman as attending physician, Department of Psychiatry, RSCM, Faculty of Medicine, University of Indonesia, and to all our webinar participants. It is a very pleasant morning to join us, all of us now, once again in NTUH-RSCM joint webinar series. The current title is our 4th episode, Mental Health Support in COVID-19 Pandemic. Since the beginning of COVID-19 pandemic in Indonesia, mental health has become a very vital, important issue. We all struggling to take care of COVID-19 patient not only for physical aspect, but also of mental aspect as well. Also, we have to consider and put attention to our patient, caregiver, and family. Depression, anxiety, paranoia, and panic are the common problem found in COVID-19 patients and their families. To address those kind of problems, we need to sustainable mental health program to our workplace. We chose this topic because it is very relevant to our daily practice today. We assume that there will be more questions arise regarding to the topics, and with this webinar will be an incredible place to explore the answers. We believe that participants will gain worthwhile knowledge from all faculties. Before we proceed to the scientific session, we would like to express once again our sincere gratitude to National Taiwan University faculty, Professor Dr. Yi-Ting, to all NTUH committee, Dr. Siste, Dr. Petrin, and all our RSCM committee. Please accept our apologies of any inconvenience, and I'm sure that this scientific session will leverage our knowledge and mental health skill. Enjoy this webinar, and we hope this will be a fruitful meeting. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Dr. Trimartani, for the speech. Now, before we move on to the scientific part of the webinar, I would like to introduce our moderator for today, Dr. Kristiana Siste, PhD. She is the head of Department of Psychiatry from the Faculty of Medicine, University of Indonesia, and Cipto Mangunkusumo Hospital. Dr. Siste, the time is yours.
Thank you, Dr. Karina. Good morning. Assalamualaikum warahmatullahi wabarakatuh. Good morning, and thank you so much for our Human Research and Continuing Education Director of Cipto Mangunkusumo Hospital, Dr. Ria Trimartani, and also Professor Chia Yung Chun, CEO from National Taiwan University Hospital, and also Dr. Yi-Ting from National Taiwan University Hospital, and my senior, lovely senior, Dr. Petrin Redayani Lukman from Department of Psychiatry, Cipto Mangunkusumo Hospital, Medical Faculty, University of Indonesia. So good morning and welcome esteemed professors, doctors, colleagues, and everyone in today's seminar titled Mental Health Support in COVID-19 Pandemic. This seminar is possible due to the fruitful collaboration of National Taiwan University Hospital and Cipto Mangunkusumo Hospital. Now, we cannot turn away from the reality that psychosocial support plays an integral role during this pandemic. This support is needed by a range of people, from those who feel they are healthy and people who came down with COVID-19 to those that have recovery from the COVID-19 infection. Even the family and close friends surrounding the patient will also require to an extent psychological assistance. When family members are quarantined in health facilities, there will be high anxiety around families and also friends, and the issue extends to social and financial problems. We are very fortunate that this morning, two leading experts in psychiatry, Dr. Yi-Ting from Department of Psychiatry, National Taiwan University Hospital, and also Dr. Petrin Redayani, psychiatrist from Department of Psychiatry, Cipto Mangunkusumo Hospital, and she is also the head of psychotherapy section, Indonesian Psychiatrist, Indonesian Psychiatrist, will share with us the form and experience of psychosocial support that has been implemented and will be implemented in Indonesia and Taiwan. This model may inspire us the addition of such support services in other facilities of healthcare. We are also thankful for our CEO, Dr. Kristiana, and also our lovely Human Resource and Continuing Education of Cipto Mangunkusumo Hospital, Dr. Yi-Ting Martani, and also for Dr. Teddy and IC Tech team, and Dr. Karin from Dikat Cipto Mangunkusumo Hospital for conducting this webinar. I invite also all participants to be actively involved in this webinar through interactive discussion, thus allowing us to be the agent of change in implementing appropriate psychosocial support for those around us and our patient. So this seminar will be conducted for 2 hours, and please, all participants actively join this seminar. At the end of the session, we will open the discussion, and I think this seminar will open the very active discussion and develop the better model for psychosocial support in Indonesia and also Taiwan. So we will have the role psychosocial support in our countries. So for the first speaker, Dr. Yi-Ting will share about mental health strategies to deal with the impact of COVID-19 beyond paranoia and panic. So paranoia and panic is very high in our community now in pandemic COVID-19, also with us. So I will feel anxiety in the morning before go to the hospital, and also when I came home, I also feel very anxiety because can my family get the COVID-19 from me? And also, I think all the people here feel the same way. So please, Dr. Yi-Ting, the time is yours for 30 minutes.
Good morning, everyone. And thanks for the kind introduction from Dr. Kristiana, Siste. I'm Yi-Ting from National Taiwan Hospital, the Department of Psychosocial. Okay. So I'm also the Deputy Secretary General of the Taiwanese Society of General Psychiatry. So first of all, thanks for everyone to join the webinar early in the morning on Saturday. So first of all, I have to say that I'm not an expert in public mental health, and I was not involved in the policy or strategy making or government. However, we have the chance to collaborate with the director of the Department of Mental and Oral Health on the Ministry of Health and Welfare. So we have chance to understand what policies and strategies our government has made in terms of psychological assessment and intervention during the COVID-19 pandemic. So with the director, we submit a commentary paper entitled How Taiwan Prevented the Outbreak of COVID-19, to focus on psychological strategies and measures, to the official journal of International Psychogeriatric Association. So the large body of my talk today will come from this commentary paper. So it is, I think it is an open access journal, so everybody can read the paper later. So I have to thank first to Dr. Li Zhongshen. He's the current director of the Department of Mental and Oral Health. The name of this department sounds somewhat strange to put mental and oral health together. But anyway, it indicates that our government put their emphasis on the importance of mental health. So in the beginning, I would like to share a paper. It was done early during the pandemic. It is a cross-sectional population survey between February 14 and 16. That is about 1 month after people knew that COVID-19 can be a threat. So the survey was done here. This survey was done online via Facebook or online via a snowball sampling strategy. So it provided questionnaires about the anxiety symptom score and preventive measures for subjects who were willing to answer the questionnaire. So their anxiety symptom score and their preventive measures to deal with COVID-19 were assessed at 2 time points. The first time point was during the beginning of the outbreak, that is during January 23rd to February 8th. And the second time point is the experiences in the past week, that is February 8th to February 16th. So all the respondents are adults aged between 20 and 70, a total of more than 3,500 responders were analyzed. So the table is busy, but I would like to show that during the first time point, that is the beginning of the outbreak, around 48.8% of respondents reported moderate to severe anxiety symptom score. And this percentage increased to the past week. About 52.1% of responders reported moderate to severe anxiety symptom scores. So as the pandemic was ongoing, the anxiety level increased with time as expected. So it's interesting to see the difference between these 2 time points. And the most interesting is a finding that among the people of the youngest age group, that is between 20 to 30, their anxiety symptom score indeed decreased rather than increased compared to other demographic characteristic group. So I'm not sure what was going on, but the young people seem to adapt better, or they show less concern. I'm not sure about it. The anxiety symptom score seems to decrease with time. And so which demographic subgroups show the most increased anxiety over time? That we can see that people with high school education, level or below, have more increased anxiety symptom score over these 2 time points. And people come from the lowest household income family was more vulnerable to the stress imposed by COVID-19, because we know that COVID-19 pandemic not only brought health concern, but also brought a much financial impact on our society. So the poorest household income group was the most vulnerable population. And this table shows which kind of preventive measures were increased during this time point. Actually, all the preventive measures were adopted more frequently over this period of time. And for the preventive measures such as washing hands frequently and disposing tissue paper immediately after coughing or sneezing, they are the easiest way to adopt. So more people adopt these two kinds of measures between these two time points. And we can see that wearing a mask, it is considered very important. But even during the February, only 31.8% responded wearing masks. I think it is related to the availability of the mask. So later on, the government made their efforts to provide everyone with enough masks. So more and more people wear masks when they go out. But even everyone thinks that preventive measures are very important for him or herself. But still, only 45.4% of people would report to the authorities or healthcare providers if they have symptoms related to upper airway infection or possible COVID-19 infections. I think it reflects not only the uncertainty or fear of the disease, but also the concern of stigmatization early during the outbreak. Anyway, the increased anxiety symptom score from the beginning of the outbreak to the past week was a strong determinant of an increased preventive measure score. So we have to say that anxiety and worry are adaptive. They are necessary for enhancing adaptive preventive behaviors. So, for example, early during the pandemic, we heard that many Westerners, they just said no to masks. They are not accustomed to wear masks when they go out. But eventually, as time went by, when the threats from pandemic increased, even the US President Donald Trump wore masks in the public. I'm not saying that he wore masks because of anxiety and worry, but I believe that it was more and more scientific evidence supports the role of wearing masks to prevent the spread of COVID-19. But the overwhelming anxiety instead can be very harmful to our society, not only to the people themselves. So early in the pandemic, when the pandemic preventive materials were not sufficient, people just bought out anything they could bought, such as facial masks, hand sanitizers, and even alcohol, rubbing alcohol from stores. So when some people really need these materials, they just could not buy any of them. So it can bring about inconvenience and to trigger more anxiety response. So we have to have strategies to prevent the happening of this overwhelming anxiety. So because we had SARS outbreak in 2013, so we have learned something about the pandemic could be very severe to our community. So unit, that is National Health Command Center, was established 1 year after the SARS outbreak. And so this command center served as an operational command point to integrate the actions taken among the central, regional, and district sections. And after the COVID-19 outbreak, specific unit, that is a central epidemic command center, was established quickly on January 20th this year, when the first case arrived to Taiwan from Wuhan. And currently, the commander of CCC is the Minister or Ministry of Health and Welfare, Dr. Shi Zhongchen. And as to the psychological strategies, the Department of Mental and Oral Health took the responsibilities. So later, I will introduce the mental health strategies of our government one by one for different target populations. The first of all is the most important one is strategies for the general population. There are three parts. The first one is the daily COVID-19 briefings held by the CCC and its commander. The second is the coping strategy and psycho-education resources provided via the official websites, social media, apps. A national hotline was become accessible since January 2020. So everyone, he or she felt needed, he could just call a free hotline for help. So this is the daily CCC briefing. I personally, as a citizen in Taiwan, I think it is the most important strategy to decrease the population anxiety. From the daily CCC briefing, our commander, Dr. Shi Zhongchen, provided latest information on local epidemic and the government policies. And every day, people are just waiting for this briefing. They can watch it on TV or through YouTube, for etc. And through this daily briefing, I think our experts in public health, infection specialty, and our officials just show up and clearly answer questions from the journalists and to answer questions from the populations. And we could read their tiredness, their exhaustion, by their efforts in dealing with the pandemic. So Dr. Shi Zhongchen gradually become an iconic political figure that could bring trustful sincere feelings to people. Yeah. So I think the daily CCC briefing is very important. So this daily briefing is not only reduce the anxiety of the general population, but it could effectively convey the important policies and what our government wish people could do to prevent the pandemic together. So I personally think the daily CCC briefing is very important early in the pandemic. And there are many efficient and important materials provided on the website of the Ministry of Health and Welfare. For example, this is for the general population, and this is for the professionals. So how to help the patients and also how to help ourselves. And there are links to other useful websites. And this is a national hotline, 1925. So it is a 24-hour free online consultation. It has been established for more than 10 years, I think. So it is not specifically for the pandemic. It was for the mental health in general. But after the pandemic, people could also call this hotline for pandemic-related issues since January 2020. So this is a chart, very small. And that is the total number of calls from January 23rd to September 14th. So total number of calls were over 68,000, and calls related to pandemics was around 8.7%. To read this bar chart, it's very interesting. The red bar is the total calls, and the green bar was the calls related to COVID-19. So we can see that during March, that is March 19 to around May, the early May, most of calls are related to pandemic issues rather than other mental health issues. So it was during this period of time when most cases of suspected or confirmed COVID-19 infections were reported. And after May, the pandemic in Taiwan become less and less. So people should less worry about this issue. So he returned to the baseline. Most of the calls to these hotlines are related to their own mental health issues. So it is a more clear bar chart. That is, you can see that the green line just increased with time during March. Yeah. So the topic of calls related to COVID-19, about a quarter of them were related to the mental health issues of COVID-19. And some were about their daily livings, some were questions about isolation and quarantine, and some how to get epidemic prevention materials. But most of them can deal with by providing information or to refer them to the CDC websites for more information. But about 20% of them were suggested to call for medical assistance. So the second part is the strategies for the vulnerable populations. This population includes the elderly, the children, the people with chronic medical or mental disorders, and those with financially disadvantaged. There are some strategies. The official special recommendations are provided, and some of them are provided in multiple languages. And our government sent official letters to each professional organization to encourage them to take actions to serve the specific needs of these different populations. For example, for the Taiwanese Society of Geriatric Psychiatry, this society provides suggestions and press conference for mental health promotion. And for the Taiwan Alzheimer's Disease Association, they provide counseling hotline and many other useful materials for the patients with dementia. So it is an example. This one is the go through the storm of COVID-19 with the older adults. And this one is go through the storm of pneumonia with children. So we can see that multiple language versions are provided, including the Chinese version, English version, Indonesian version, Vietnamese versions. Because many of our citizens were from Indonesia or Vietnam. So these two versions are very important for other people. And there are also specific guides on pandemic prevention for people with mental disorders and their relatives. These guides were provided by the Taoyuan Taoyuan Psychiatric Center, Taoyuan Psychiatric Center. And what the version is in Chinese. It had specific recommendations for situations such as patients with mental health living in the community, and for recommendations to the psychiatric rehabilitation institutes for patients receiving occupational rehabilitation but they still live in the community. For children receiving rehabilitation, for patients with substance use disorder and others. And it is the material provided by the Taiwanese Society of Geriatric Psychiatry. It's an English version, but we have Chinese version as well. So we encourage elderly people to adopt PEACE, P-E-A-C-E, to go through the pandemic. For example, P is to explain with own language and make clear in a peaceful manner to help the elderly understand what's going on and the facts about COVID-19. E is to keep an everyday routine and to maintain emotional balance. A is to when you find yourself or find your elderly relatives preoccupied with the COVID-19 pandemic, we can help to alter their attention to other aspects and to provide alternative activities. C is to show consideration to elderly, to care that those people with dementia. It's very important in the pandemic. D is to have adequate exercise and to stay active and to expect connections via 3C devices. The third part is for those who were quarantined, isolated, either compulsorily or not. So I have introduced the strategy for the general population. One of them is hotline. People could just call in to get support via the hotline. And the second one is for people who were suggested to isolate or quarantine at home. The Taiwan Centers for Disease Control have been registered for these people. So there is a call center who can access this register and to actively call out to those people who are currently home isolated or home quarantined to assess, do they have any needs, for example, the mental health needs or the physical health needs. So if they address that, they do have needs, and advanced psychological consultation or referral system will be in action to help them. So for this population who were home quarantined or isolated, there is another service center which taking actions since March 1st. This service center not only provides necessary help, but so for people who were isolated at home, they could get food, to get connection devices, to get preventive materials they needed through this service center. So people do not feel alone when they are isolated or quarantined at home. Many people reach them every day, and many people call them every day to assess whether they need some help. And the third one is some people are compulsorily quarantined in places that is they are suspect to have COVID-19 infection, or if they are confirmed cases, they were admitted to a hospital. So for this population, there are nurses to take care of them. So if they show emotional problems, the referral nurses could call the core psychiatric hospitals to provide telephone consultation by affiliated psychologists. So the different populations have their individual needs. So the government designed a system to provide what they need. Here, I would like to talk more about the call center. It was established on February 11th. Firstly, they assessed whether these people who were isolated or quarantined at home have psychological need. So the call center staff were mainly psychologists and nurse volunteers. And as for some reason, this call center was closed on March 17th, but it was reopened quickly 1 day later because there are more and more imported cases from other countries. So during this period of time, the call center just addressed their physical need in the beginning. They don't ask whether they have some psychological need too. But later, the psychological need and physical need were both assessed after April. Actually, with the service center, they also provide necessary materials or support. Only 0.3% of people assessed were referred to psychological counseling. That is to say that even people who were home isolated or quarantined, their mental health needs could be supported via their relatives, their family, and the service center for home isolation quarantine. The fifth part is for the hospitalized subjects. They are either confirmed or suspect COVID-19 infection. So our government addressed the need of mental health assessment care. So they asked each hospital to provide care for this patient with COVID-19 infection to address their psychological need. So if necessary, psychiatric consultation is available in each hospital. as for the bereaved family, the call center not only reach the subjects with suspect COVID-19 infection or with subjects home isolated or quarantined, but also assess their families. So if the call center found that the family members probably suffered from tremendous bereavement due to the rapid death from COVID-19, so these family members could be referred to the community mental health center. And other important part is for the frontliners. The frontliners are the workers in the medical institution during epidemic prevention. So we have official documents of suggestions on measures of psychological support and assistance for medical institution workers during epidemic prevention. And there are also mental health education materials provided for medical professionals as well. The last part is for people with dementia and their carers. During the COVID-19 pandemic, we have national rules for controlling visitors to long-term care facilities to prevent the spread of COVID-19. So since the family couldn't visit their relatives in these long-term care facilities, they must have some way for them to address their care. So through the 3C products, through video taping or through online video. So we just need to work out to show our concern over the elderly or people with dementia living in the facilities. And the Taiwan Alzheimer's Disease Association published a reference handbook on dementia care responding to COVID-19. It is also available on the official site of Alzheimer's Disease International. For example, they have specific recommendations to help people with dementia to wear facial masks. It's not an easy task, but so this recommendation provides some tips. So in summary, the Taiwan government has provided comprehensive psychological measures to help people cope with COVID-19 pandemic. And we have to provide individual measures for their special needs. And not only the government, I think the professional could also help a lot. And so it was not only the responsibilities of our government, we professionals have each individual roles to help people dealing with this pandemic. The most important thing I address repeatedly is a trustful gateway to get latest pandemic information. When we know more about the pandemic, we fear less. So very important. People should have confidence that the latest information is always available for them. So the daily CECC briefing is quite important in the beginning of the pandemic. So that's my talk. Thanks, everyone.
Thank you so much, Dr. Yi-Ting Lin. So this is very comprehensive model in Taiwan. You start from the community and then the end of and then continue to the hospital and health service center and also back to the community. So you your country developed a CECC, Central Epidemic Command Center, to give the services for the community, and also you have a service for vulnerable population like geriatric patient and also children and women. And I very amazed because you have a special treatment for dementia people. So it's very important, and also for substance abuse because my subspecialty is in substance abuse. So I'm very curious about it. So thank you so much, Dr. Yi-Ting Lin. And we will have a discussion at the end of the session. And please, audience, so you can prepare the question for Dr. Yi-Ting Lin and ask him for everything about psychosocial support model in Taiwan. So we continue to the second speaker, Dr. Petrin Redayani Lukman. She is psychiatrist from our department, psychiatric department, Cipto Mangunkusumo Hospital. And she's also my senior, and she's the expert of psychotherapy in Indonesia. And she will present the very interesting topic. And this is the real experience from us in Cipto Mangunkusumo Hospital. And the title is Developing Psychosocial and Mental Health Program for Hospital Workforce Resilience during COVID-19 pandemic. So the time is yours for 30 minutes, Dr. Petrin.
Okay, thank you, Dr. Kristiana, Siste, for your nice introductions. Can you see my presentation?
Yes, and you can do slide show. Yeah,
Okay.
thank you.
Is it okay? Okay. Good morning, everybody. I am from Psychiatry Department, Cipto Mangunkusumo Hospital, and this morning I will share our experience in developing psychosocial and mental health program for hospital workforce resilience during this COVID-19 pandemic. So I will start by giving you all the introduction to COVID-19 situation in Jakarta, Indonesia. And we know that the first case started to appear in the early March in Jakarta. And following that, the government implemented the large-scale social restriction scheme on April. And we call it a PSBB. And there are two PSBB, PSBB 1 and PSBB 2 on May. And we can see that there is this regulation can slow down the increased rate of the new cases of COVID-19. However, when the government loosened this restriction on June, we can see here that there is an increasing rate of new cases in COVID-19, and we can see on this September there are more than 11,000 positive active cases appear in Indonesia. So this number, the increasing number of cases, affect the healthcare workers in Cipto Mangunkusumo Hospital. The increase in number of cases results in an increase in workload and infection risk among healthcare workers. And this situation leads to psychosocial problems among them, such as stigma, violence, burnout, and financial problems. We can see that, however, that healthcare workers are vulnerable to have mental health problems and impair their performance in delivering health services. So that's why they need support to enhance their resilience, to keep their well-being, and then to help them in a good and proper conditions. Based on that, Department of Psychiatry Cipto Mangunkusumo Hospital conducted survey and questionnaire to get the description about psychosocial problems among healthcare workers at Cipto Mangunkusumo Hospital. And this survey was conducted in March 2020 with almost 400 participants. Most of the participants were women, and most are aged 20 until 39 years old. And they were comprises of medical doctors, nurses, and other healthcare workers. And the education qualification mostly were diploma and undergraduates. And healthcare worker working experience ranges from 4 months to 35 years. And this is the healthcare workers' concerns and needs. Their concern included fear of contracting the COVID-19 virus and transmitting to family members, concern about health and well-being, regulation to seek medical help if needed, afraid of inadequate protective equipment, worried to be stigmatized from society, and managing how many mental health symptoms they suffer, such as insomnia and anxiety. while their needs were access to mental health services either face-to-face or online, and they also need an adequate information and examination. And this is the self-reported questionnaire result, which fulfilled by 204 respondents. 57.8% of the respondents reported tend to be problematic, and 3 respondents reported suicidal ideations, and 39.2% of respondents expressed that they have symptoms of depression and anxiety, and 33.8% of respondents expressed that they have PTSD symptoms. So from this result, we can see that psychosocial intervention for healthcare workers was highly needed. So that's why our department, psychiatric department, designed the psychosocial intervention for a healthcare worker at Cipto Mangunkusumo Hospital. Based on urgent psychological problem we found from the survey, we developed several psychosocial interventions using or utilize local resources and internet technology, such as online consultation, online peer counseling, online group therapy, online psychoeducation, and video-based psychotherapy. And we will further discuss about each interventions in the following slides. First, we will discuss about online consultations was held using either phone or video call. We use video call when the client needs to face-to-face consultations. And the client who needs this service will contact this link, and there is the officer on duty can help them and distribute this client to the counselor. The team of counselor consists of 12 psychiatric residents and 8 attending physicians. From March until now, there were 80 healthcare workers who registered for online consultations. And during the counseling, this is the following themes that they conveyed to us, that they worried about contracting the coronavirus, worried about transmitting family members. They got the sleeping disturbances due to anxiety, fear of contracting because of working in the emergency room, feeling unfair about placement in ER, and they worried about inadequate PPE supply, anxious to hear information about COVID-19, and they were stigmatized by experiencing flu symptoms, and they find difficult to find activities for children at home during this pandemic. They have to stay at home. The children study from home, but the parents have to go to work. So they have it's difficult to find the productive activity for the children at home. So the counselor give them the psychotherapy interventions in a form of supportive. The counselor being empathic towards the client's feelings of anxiety, worry, and anger, and help them to manage these issues. The counselor gave the reassurance. The counselor reassure and support correct actions have been done by the client. For example, while the client using PPE, taking a shower after work, being aware of the duty and risk of his work. And the counselor also provide safe situations during the consultation sessions for the client to express themselves. Another approach is about managing thoughts and feelings. This approach was given to the client who have a negative automatic thought, such as, I'm very afraid of getting infected because I have treated COVID-19 patients. I feel victimized in this situation because I got sick assignment in the isolation room. I feel victimized is a negative thought. I'm not ready to die. My child is still so young. So the counselor discussed these themes to the counselee, to the client. How do you feel when you get these negative automatic thoughts? And they mentioned that I'm become more anxious and I'm afraid of this situation. So the client will help the counselor will help the client to gain the insight that their negative feeling leads to the negative their negative thoughts leads to the negative feelings they suffer now. And then the counselor help the client to find another more reasonable or rational thought that can help the client to get more comfortable feelings. And then the counselor also trained the client to develop adaptation skills, such as limit reading information or access to social media to prevent their anxious, make a diary of physical symptoms to make them have a control of their own, and then made a planning activity with the family so they can cheer up the situation and in the family, in the house, and then get social through video calls. And another approach that counselor give in this psychotherapy sessions is relaxation. It helps the client who have panic or anxiety. They were helped to practice take a deep, relaxed, and regular breath. Relaxes the muscles from head to toe. Imagine a comforting and quiet place, such as in a mountain or in the beach. Then they also were asked to have positive self-talk that could be repeated from time to time. For instance, from now on, I will always become relaxed and healthy. They mention it in the sessions trained by the counseling, and will repeat it in the daily life. This is the feedback from 22 clients. They mentioned that these consultations make them feel satisfied and help them when they have get these consultations. And then 95.5% of the respondent of the client, would recommend to the colleagues about this service. And I think this is a good feedback from the clients who have already have this counseling process. They also express the following expectation for the counseling service, that 72.7% ask or express that counseling takes place outside of working hours. And they also need a special number that is used for counseling services. Okay, now we move to discuss about peer counseling. This is almost quite the same with the previous procedure, but this is especially designed for the resident. This program, Community Psychiatry Division of Department of Psychiatry, developed this program, peer support, in the form of peer counseling to help residents from other departments ease their distress due to their duty during the pandemic. And counseling was done by psychiatric residents, not attending physicians. So we call it peer counseling. This was done to increase comfort during counseling, as talking to fellow residents would be more comfortable than talking to an attending physicians. 12 residents from other departments registered to have peer counseling sessions. And during the peer counseling sessions, they convey the following problems. First, about anxiety. About the anxiety, at the beginning of the pandemic, clients were anxious about the contracting the disease to other family members, and also anxious or worried about the availability of PPE. And as the number of cases increased, clients to develop frustrations about the never-ending pandemic and increasing workload and feeling burnout. And they also think about or concern about the length of the residency program will end, will finish in a proper time or not. And another problems they convey to us is about physical symptoms such as headache and stomach ache and sleeping disturbances, and also fear of spreading the disease to their family members. Now we discuss about online group therapy, and this online group therapy was designed to help the healthcare workers after they shift on duty, and then after the shift they have a free time, and we consider that the same situation or the same experience they have experienced in the duty can be discussed through this group therapy. 14 healthcare workers registered, but only 4 participated in the group therapy. 7 counsel and 3 switched to individual counseling due their tight schedule. So after their duty on the red zone, they have to get the free time to take a rest, but actually in reality they have another job, maybe with by online task to do, so they have no time to join in the group therapy. But from participate, we can see the problem convey, such as physical exhaustion due to increased workload, worried about being kicked out of their residence, worried about spreading the disease to their family members, worried about contracting the disease despite wearing complete PPE, afraid of making their family worried excessively, missing their family members, and concern regarding the lack of information being disclosed by their superior. And from this program, the participant gained the insight such as needs for a follow-up group session, needs for counseling or follow-up sessions in private, helping the patient to see that they have a good support system, and helping the client, I mean, to realize that their thoughts are not logical. And the resident also should continue their good attitude, such as to implement transmission prevention procedures, proper usage of PPE, maintain hygiene and cleanliness, and trying to accept these difficult situations by only concerning things that are within their control, pray that the situation will pass soon, and propose positive changes that can be made. And they can ask the clarification if there are any questionable information to their superior. Another intervention was online psychoeducations. This psychoeducations was developed to help healthcare workers who cannot or are not able to access the online consultation due to their strict schedule. So this online psychoeducation is easily distributed to others by using online platforms such as WhatsApp group or email or other social media platforms. So we developed this kind of psychoeducations, such as this flyer was made by psychotherapy divisions. And this flyer discuss about how to deal properly in these pandemic situations, to be calm, select the proper information to prevent anxiety, and create the productive activity at home, and do the relaxations, and keep in touch with a relative via online communications. And this flyer was made by community psychiatry divisions to help residents overcome their burnout during this pandemic. Now we move to the last intervention we designed about video-based psychotherapy. Video-based psychotherapy was developed by Psychotherapy Division, Department of Psychiatry. And psychotherapy video is an alternative method when face-to-face therapy sessions are not possible due to the need of social distancing during this pandemic in order to minimize transmission of COVID-19. And video-based psychotherapy is especially aimed for patients that are treated in isolation room to reduce psychological distress during their treatment and recovery. And patients include co-health workers that were infected during their duty. These psychotherapy videos consist of three topics. First, about relaxation video, and the second about managing thoughts and emotions, and the last is a mindfulness video. And each video lasts for 10 to 15 minutes. And these videos were shown to the patients in sequence. And this is the feedback from patients. They mentioned that these are the adequate video durations. And after watching the video, they feel less feeling of distress. And this video helps to think rationally, helps to relax and reduce anxiety, and helps them to focus on present moment so that they can feel calm and natural. And finally, it helps them to improve their resilience and adaptation and keep their well-being. Now we come to the conclusion that the pandemic creates various stressors, including social burden on healthcare workers. Healthcare workers need to get psychosocial support in order to increase resilience and support service performance. And Cipto Mangunkusumo Hospital provided psychosocial support services based on affordable information technology and available human resources. And the support that has been given to healthcare workers at Cipto Mangunkusumo Hospital are online consultation, peer counseling, group therapy, psychoeducation, and video-based psychotherapy. Okay, I think this is the end of my presentations, and thank you so much for your kind attention. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam. Thank you so much, Dr. Petrin, for the very comprehensive presentation. You focus on the services for health care in Cipto Mangunkusumo Hospital, because I think mental health of healthcare in our hospital is very important to give the best services for the patient. So I think the two countries have similar program, but actually in Indonesia now we are still facing a very high cases of pandemic COVID-19. It's so different with in Taiwan, I think. So we can share the experience from both of you, and I invite the audience to ask the question to Dr. Petrin and Dr. Yi-Ting. So is there any question from the audience, Dr. Karina?
Yes. Dr. Siste, thank you. The questions will be displayed on the PowerPoint slide, as you can see on the screen.
Oh, yeah. Yes. So this is the first question for Dr. Petrin and Dr. Yi-Ting. Many people, especially here in Indonesia, tends to ignore the true existence of COVID-19 pandemic. Therefore, they disobey the health protocol. Is this action is part of their anxiety of COVID-19 pandemic? If so, how can we manage that anxiety so they will have acceptance of this pandemic and obey the protocol? So I saw in the slide screen of Dr. Yi-Ting, you mentioned that just 30 people use mask in the survey, national survey. So I also very surprised about it. So not 100 people or almost 90% people use mask, but just 30% people use mask in your national survey. So it's also happened in Indonesia. So please, Dr. Yi-Ting, do you have any opinion of this question?
It is a difficult situation because from my personal experience, some patients really do not believe the existence of COVID-19. So there may be some reasons for this kind of reaction. I think one is that they feel helpless if the COVID-19 do exist because they don't know how we can conquer the virus, or they don't know how can get help from a medical service. So I think trustful information is very important for all the people, especially for people with they don't use internet. For example, the elderly population, their information sources are very limited. So how to convey necessary information to these kind of people are very important, especially for people with dementia. People with dementia tend not to wear masks, and they cannot change their behavior patterns in order to prevent the spread of the disease. So their family members should take important responsibilities for helping them. But it remains difficulties. But I think the transparent information available to all people are very important. Thanks.
Thank you so much. So you think that giving massive information is very important for the community because it's very challenging if the people does not have internet connection, right? So maybe we can get or use the other media to give the information. So how's in Taiwan? If for the people who does not have internet connection, what media do you use to give the information, Dr. Yi-Ting?
I'm not very familiar with this part because I live in Taipei. I think most of people use internet. Yeah.
I see.
But we do provide psycho education information via papers. Yeah.
Okay.
I think the local communications, for example, the local health center could provide some information to elder residents. But I'm not very familiar. Sorry.
Yeah. So that's a great idea. So you also have CECC that I heard from your presentation. They give information every day, every morning about the cases in Taiwan. So maybe it is very useful to give information for all the people in the community.
Yeah.
So yeah, thank you. So Dr. Petrin, so this is the real situation in Indonesia. COVID-19 is conspiration. It's not there. So it's just like hallucination or delusion from the healthcare or from the government. So this is the real situation in Indonesia. So not everyone use a mask for it. So please give your opinion about this question, Dr. Petrin.
Yeah, we are very sorry for these situations because some of Indonesian citizens ignorance and not accept this emergency, these urgent situations. I think we are have a gap in education, has a gap in economy, and also in health literacy. So I think it's a obligation from the leaders or local leaders to give the psychoeducation to the community, because some of them don't realize that this pandemic is real, and they still go outside without masks. But when we tell them maybe the approach is more private and give them the proper education, they will understand and try to use the mask. If mention about some of the government say that it's the problem is not real, yeah, me myself feel very sorry to hear that. But we are in the Ministry of Health now is trying to develop the guidance for giving the mental health support for co-health workers, and hopefully that we can also develop for the community.
Oh, okay.
Develop this guidance for the community.
Okay, so the government will start to develop module for healthcare workers, Dr. Petrin. Yes, for mental health support. Yeah, because it's very important. And you mentioned a very important things that we should give education and information due to the education of the people. I mean, for the university student and for the children, so we can use the different information. So I think it's very important to give a very wide range of information due to the education of the people. So they can understand the information very well. So thank you, Dr. Petrin. And okay, there is a second question. Okay, so this is also for both speaker. As you know, Indonesia is a very big country with high population, and now we face challenges regarding the perception of our citizen about COVID-19. Many of us still underestimate and undermine the seriousness of COVID-19. Do you think it is necessary to take extra measure like disseminating bad news to induce anxiety and fear just enough to make us more aware? Oh, yeah, this is very important question. So is it necessary to disseminating bad news like how many people die today, and what is the impact of the COVID-19 for financial and also for health of the people? So what do you think about it, Dr. Petrin?
Yes, I think this is a good idea to publish the reality that how many people die from this COVID-19, and I think we need support from the government. The government should inform these informations in a formal form. I mean, through the media or through the social media, so the people will not ask the information from hoax from media, social media. So the government should give the proper information and formal information for this. So they also can ask the people from in Indonesia to be more aware with these dangerous situations, and have to ask the people in Indonesia that we have to prevent it altogether, not not healthcare workers who have the obligation to prevent this pandemic, but all the Indonesian people.
Yeah, sure. So perfect. So it's very important to do that. So how about in Taiwan, Dr. Yi-Ting? What is your opinion about this? So this is the Indonesian real situation.
Okay, our mass media always disseminate bad news to people, I think. But from the point of view of psychosomatics, we know that adequate anxiety could facilitate adaptive response. So we have to prevent the anxiety from being overwhelming. So when providing bad news or negative information, we have also provided solutions. Meanwhile, so the mass media could reported that how many cases has come to Taiwan with COVID-19 infection, and what the actions we have adopted to overcome this situation. So people can feel that it is necessary to concern the COVID-19 seriously, but they also gain confidence in dealing with the pandemic. So I think it could facilitate a positive cycle to let people aware of the importance of pandemic prevention, and also to facilitate them to adopt more adaptive behaviors. On the other hand, there are some news or information that are really misleading. Yeah. So I think the authorities should take actions to decrease or to stop the spread of this misleading information. I think it can be very harmful because there are some, I cannot say bad intentions, but we know that in social media everything could happen. So we should take some steps to decrease the spread of this misleading information.
Yeah. So Dr. Petrin and Dr. Yi-Ting mentioned about the misleading information or hoax information, and there are many misleading information in Indonesia, right, Dr. Petrin? So maybe we can use media to share the right information every morning, and I think we can also use testimonial from the family of the patient and also from the patient side about how they can get COVID-19 infection and how can they get through the infection and how the impact of the infection for him and also the family. So I think we are as healthcare workers should disseminate or distribute the right information about COVID-19 pandemic. And I think massive information is very important. Yeah, so thank you so much, Dr. Petrin and Dr. Yi-Ting. Is there any question again, Karina? Okay. Also, this is for Dr. Petrin. Do you have any distinctive program to support mental health of the patient and their families? Please, Dr. Petrin.
Yes. We also developed the mental health support for the patients and the family, especially the video-based psychotherapy is designed for help patients in the isolation room. So it's help the patient as well. And for the family of the patient, we have we call it Pojok Sahabat. This service is help the family of the patient to get the information about the patient's condition. So there is an officer on duty every day, and they will help the family member if they have questions or they need information about the patients in isolation room. And they can contact the patient, the family member can contact the patient using the online, using the online video call. So the hospital prepared the tablet. So there is officer in the pojok sahabat and the officer in the isolation room that can help the family member contact to the patients. And they also can ask the information about the patient to the physician, the attending physicians that take care of the patients. I think that is that we have implemented in Cipto Mangunkusumo Hospital, Dr. Siste.
Yeah. So, Dr. Petrin, you mentioned about online video for the patient. Can you explain more about it? What is the useful of it? So maybe our colleague can use the video, the online video in their treatment center.
Do you mean the video-based psychotherapy, Dr. Siste?
Yes. Yes.
Okay, yeah, we developed this video-based psychotherapy because we have to give the mental health support as well to the patient, even though they are in the isolation room, and to prevent this the spreading of the infection. So we limit visit the patient face to face. So we thought then back then that maybe by watching or listening to the video about some psychotherapy approach, it can help the patient. So we developed these three topics of videos about relaxations and how to manage our thoughts and feelings, and about mindfulness, and the feedback from the patient is it helped them to be more comfortable, Dr. Siste. So this program, this video played in sequence to the patient. They can choose the proper time for themselves, maybe in the morning or after the physician visited them, so they can choose the right time, and then the nurse will help them to watch the video through the tablets. They can click the link that can access to the video-based psychotherapy. They watching the video, and then we also teach them to self-rating their distress.
Yeah. So you are doing the research now, and maybe one day you can share the result of the research and do the training for other colleagues to use the video, the online video psychotherapy based on psychotherapy. Thank you, Dr. Petrin. So how about you, Dr. Yi-Ting? Do you have any such program with psychotherapy online video for the patient, like they do relaxation by themselves, so they can choose the time to use that video, maybe in the morning, in the afternoon, or at night. So this is like a self-treatment.
We do not provide video consultation or online psychotherapy in our hospital. Some reasons are related to the regulations themselves. So another reason are that we fortunately the case loading are not less significant in our hospital. That is the patient with COVID-19 infection. The case numbers are manageable. So currently we do not provide online psychotherapy. But I know some private therapists have already adopted this method to provide online therapy. And our government of policy making, they are thinking about telemedicine or telehealth in case that the COVID-19 becomes a real problem in the future. So I welcome the innovation of online psychotherapy, and I'm very happy to listen from the experience shared from you.
Yeah, thank you. So the cases in Taiwan is manageable, right? Different in Indonesia. Okay, so I saw other question, Dr. Karina. So this is also for Dr. Petrin. Do you think it's needed to do regular and mandatory mental health checkup for all medical residents? Please, Dr. Petrin.
Yeah. Actually, we built or we developed this program by distribute the survey about self-reported questionnaire to healthcare workers to find whether there is a case from the residents as well. And if you ask about the medical checkup, mental health checkup regularly, yeah, it can be provided by us, by a psychiatry department, but we have to think and discuss it further, how the program will conduct and how the system will we apply, and then we have to also discuss with the what I mean KPS. What is KPS? With
Head
the of education of a residency program in every department, I think.
Yes, sure. So I think this is very but please, Dr. Petrin.
I think this is a good idea, but it is also initiated by the community psychiatry divisions by giving a self-reported questionnaire to other residents. They among the residents, they have the organizations that they can communicate each other. So we can use this platform to make or to test and distribute this self-reported questionnaire to them, so we can also offer the service that we have about peer counseling to them.
Yeah. But the highlight is it mandatory? Because we distribute the online SRQ 29. So Dr. Yi-Ting, we use SRQ 29, but not all of the residents fill the questionnaire because maybe they are afraid of being know that they have a psychopathology like that. So maybe it is mandatory like a physical checkup, Dr. Petrin?
If checkup is not mandatory for the residents.
Yeah, but we can develop it in the future.
I think it's a big task, because the number of residents is very big. I think it's more than 2,000, almost 4,000. But if we want to do this, I think we have to make a collaborations and a good planning to build this system.
Yes. So maybe we can discuss and develop it in the further. Okay, thank you, Dr. Petrin. So how about you, Dr. Yi-Ting? Yeah, Dr. Petrin, do you want to add something?
Also to discuss, I have a meeting with also the dean of the faculty medicine and with CEO here.
Yeah. Thank you, Dr. Petrin. Yeah. So, Dr. Yi-Ting, how about in your country? Do you have mental health checkup regularly, especially for medical residents?
We have mental health checkup, some kind of mental health check. That is called mood temperature meter. That's a very simple questionnaire for every workers in a hospital, in my hospital. So I think it is anonymous. So our staff is required to fill the questionnaires, and they are also provided information that when your questionnaire score is above some cutoff point, you could reach for individual consultation or psychosocial support in our hospital. So I think it is not compulsory measures or to trigger some paranoia or excessive worry about filling these questionnaires. It's just a kind of help provided by the hospital. So in case you really need help, then you could, by filling out the questionnaires and to detect the problems you may suffer and to seek help. But if in my point of opinion, when the pandemic is really a serious problem, burnout can be a very common situation for all the workers in the hospital. And the burnout could impair their occupational performance. That is to endanger the safety of our patients and ourselves. So I think at that time, the mental health checkup may be very important. And as to the mandatory nature, I'm not quite sure, but I think we should step further to deal with these issues.
Yes, yes, yeah. So, how many healthcare workers come to your department because they ask help from you after fill the survey, after fill the questionnaire?
I don't know the exact numbers.
Yes, yes. Thank you so much. Because
they can reach the clinical psychologist first. Now directly clinical psychiatry.
So they come to psychologist first, and then the psychologist refer to the clinical psychiatrist.
Yeah.
Okay. Yeah. Thank you, Dr. Yi-Ting Lin. So, is there any question, Dr. Karina? This is for you, Dr. Yi-Ting Lin. In Taiwan, do you see many burnout or depressed healthcare workers during this pandemic? So this is very hot issue about burnout in our hospital. Please, Dr. Yi-Ting Lin.
I do not have the number, but we do see some burnout healthcare workers in our hospital. But I think the number is not that high. Yeah, I was some courses was referred to my clinics prominently, but most of the time their psychosocial or psychological need can be addressed by just their colleagues. Yeah, because the case loading is not that high, so our co-workers they have strength or they have extra effort to deal with other colleagues with emotional problems. Meanwhile, so I don't really see many burnout workers in our hospital.
Yeah, because the case is not so many, and it's different with our country. So you are very lucky, Dr. Yi-Ting Lin. So how about in So Dr. Petrin, maybe you can give opinion about it for burnout healthcare workers. What do you suggest to decrease the burnout and then to prevent the burnout?
Yeah. As I mentioned in my presentations, that we develop some psychosocial intervention for them. Yeah, we provide these interventions to the healthcare workers for healthcare workers, but unfortunately, because due to their tight schedule, so not many healthcare workers can join this program, this psychosocial interventions. But if they really need to help from us, we continue to provide this program until up to now, and we'll continue this program for them. And I think through the group psychotherapy, it also will help them to reduce the burnout. For instance, I also help the healthcare workers in other hospital. They mentioned that they get insight and they feel more at ease after have the group psychotherapy sessions. So many of these interventions we have conducted, I think will help the healthcare workers to reduce to release their burnout.
So it's important to express the feeling, Dr. Petrin, because we cannot stop the cases come to our hospital. We cannot stop pandemic now, but we can express our feeling about our feeling about the sadness or the anxiety to the other colleague or to the psychiatrist. So it will be help for the healthcare workers. Thank you, Dr. Petrin. And how about you, Dr. Dr. Petrin?
The leaders in every department should provide the holding environment to the staff so they can express their feeling safely before they go to the psychiatrist or the psychiatric residence for consultation. So every leader in every department and every unit have to provide this comforting environment to the staffs.
Yeah, that's very important. So the people who come to the psychiatrist and express their feeling will not feel stigmatized because the leader can give the permission to do that, and there is no stigmatized to the people who go to the psychiatrist and express the feeling like that, Dr. Petrin. Yeah. So Dr. Yi-Ting, you mentioned that the burnout is very few cases of burnout in healthcare workers in Taiwan. So how do you prevent the burnout? How do you prevent it? What is the program do you use to prevent the burnout among healthcare workers?
I think I agree with Dr. Petrin that able to express our feelings are very important to prevent the beginning of burnout. So co-workers need to have time and chance to express their feelings. So if they are overwhelmed with the work from pandemic prevention, they do not have chance to express their feelings. So another issue is that workers should have a sense that they are not forced to deal with these problems. That is, everyone is taking their responsibilities in fighting against COVID-19 together. So it's not a problem that need to be solved only by the medical systems. Everyone is involved. So this feeling is very important for we medical staff. Yeah. Another point of view is that I think the government should take actions to prevent burnout of hospital workers, and that is to limit the case loadings or to equally distribute case loadings among hospitals. And there's some debate over whether we should do a general screen for COVID-19 infection in the community. Now we know that the screen could result in many false positive cases, and these false positive cases may be admitted to the hospital, and it could cause excessive burden on the health workers. So I think the government should take some actions to. It is not my expertise, but I think it's also government's responsibility to deal with the burnout phenomenon of health workers.
Yeah. So I agree with that. So express the feeling is very important. And you mentioned about this is not just our responsibility to decrease the COVID-19 cases. It's not about just medical workers' responsibility, but it's all community responsibility. It's all people responsibility in Indonesia and also in Taiwan. So we are not alone. Okay. So is there any question again, Dr. Karina?
There are no more questions.
Okay. So I think we have many questions. And can I ask you, Dr. Yi-Ting, the question? So I work on addiction field in our hospital. And we have like methadone patient and also Suboxone patient and also benzodiazepine dependence patient. So I would like to ask if you have any special program like you mentioned in your presentation for substance abuse patient.
In our hospital, we do not provide specialized service to people with substance use disorder. Actually, when we see people with substance use disorder, we just refer to other security center. So I'm very sorry that I could not provide many information.
It's okay, Dr. Yi-Ting. Yeah, so maybe Dr. Petrin or Dr. Yi-Ting has a question for each other.
I think it's enough.
Okay, it's enough. So, Dr. Yi-Ting, do you have any question for Dr. Petrin?
I have no question, but I really learned a lot from Dr. Petrin's experience in doing such important mental health support for the co-workers. I really appreciate it. Yeah, I feel very warm about listening to it.
Oh. So thank you so much. Yeah, Dr. Petrin, please.
I just want to say thank you to Dr. Yi-Ting, and I also learned much from your presentations, and maybe it will help us in Indonesia to implement or build the guidance for social co-health workers in Indonesia, how to give the guidance for them, because our ministry our health ministry will develop the guidance for the healthcare workers as well. So I think it's helpful. Your presentation will help us to build this this program. Thank you so much.
Thank you.
Yeah. So both presentations are very important to develop the mental health support better in our country. So there is no question again, Dr. Karina?
No, doctor, there are no more questions.
Okay, so yeah, so the time also limited for the this webinar. So I will conclude the item or the issue of this hot topic. Psychosocial intervention is very important and should be done massively in the community, not just in the community, but also in the community and hospital and primary health care, and also in the family. So it's very important to do psychosocial intervention, but it's not just psychiatrist's responsibility. So we can ask the other profession to do psychosocial intervention, like in Taiwan, among psychologists also included in the program, and also a general practitioner, and also I think the leader in the community. We should include them to develop a psychosocial support in the community. So it's very important for us to do training for them, and also this is very important to give massive information, not misleading information, but the real information. So the community will know the real situation in our country, and there is no stigmatization for the health workers who express the feeling and feel I'm sad today, I feel anxiety today, and please help me to do through this feeling, and I'm so worried about my family and also for our health. So there is no stigmatization for the health workers to express the feeling. So I think we have very fruitful webinar today, and thank you so much for Dr. Yi-Ting from NTUH for your session this morning. And it's very important for us, especially our department, psychiatric department, to build and to develop the better mental health support or program in our hospital and also in our country. And thank you so much for Dr. Petrin Redayani for your very fantastic experience and program for the health workers in Cipto Mangunkusumo Hospital, and it's very innovative program, I think, Dr. Petrin, and you can share to the other colleagues to do that in their healthcare treatment, healthcare services. So thank you so much for Dr. Yi-Ting and Dr. Petrin, and also Dr. Karina for mastering this session. And I will get back to you, Dr. Karina, to end the session. Thank you, Dr. Karina.
Thank you, Dr. Siste, for the And thank you for the speakers for the excellent webinar and discussion today. And we will like to inform the audience about the next episode of the joint NTUH-RSCM webinar series. The next episode, which will be on 24 October, will be about the miscellaneous issues in the field of immunology during COVID-19 pandemic. And it will be held at 9 a.m. until 11 a.m. Thank you for the participation and the questions and the discussions from our esteemed faculty members. And thank you for the conclusion by our moderator, Dr. Siste. And by that, I would like to conclude today's webinar and thank you for your attention and good morning, everyone.
Good morning. So see you again, Dr. Yi-Ting Lian. Maybe in Taiwan. Okay. So see you. Yeah, bye-bye. Thank you, Dr. Karina. Bye-bye.
Bye.
Thank you, Dr. Moderator. Sister. Mana? End session.